outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal too. He's first in America, first in New York, first for you with body radiosurgery. We hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212 Choices, 212 Choices for a fresh second opinion. Most insurances, Medicare, Medicaid, accepted. Not only super convenient, super. Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212 Choices.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based upon PSA, Gleason score, and stage. That's why Dr. Lederman's custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid accepted. Call Dr. Lederman at 212 Choices, 212 Choices for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212 Choices. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212 Choices.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212 Choices for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Hey, we're back, and we're talking about how to live better, healthier, longer, with less cancer death, with your body intact. That's our goal. Keep the body intact, cure the cancer, live longer, prevent cancer, learn the data. We have many doctors who listen to this program. I know that you might be surprised, but actually every week, several doctors call me and they say they like the program, they like to listen, they listen while they're jogging or going to work. So it's a compliment, and I appreciate it, and thank you. And thank you for your kindness in listening, because we know you have other choices out there, and we know that this is a choice that we like you to make. Follow-up news. So we have a patient we treated 12 years ago for kidney cancer. Kidney cancer often occurs in smokers. People with kidney cancer sometimes don't know they have kidney cancer. Sometimes they have pain in the flanks. Sometimes they have bleeding. Sometimes even they have a mass that's felt through the abdomen. Well, this is a woman who came to us more than 12 years ago with kidney cancer, and at that time she chose not to have the kidney removed. She was told, well, she should have her kidney removed. The surgeon came in. He told her 50 reasons why she should have the kidney removed. She came to us. We gave radiosurgery. Radiosurgery, by the way, is pinpoint treatment. It allows us to focus beams on the cancer and avoid harm to healthy tissues. So she had a choice. She could have no treatment, which is not a great idea. She could have surgery, which is removing the cancer. There's other treatments. And she chose radiosurgery, which is a non-invasive method to try to attack and kill the cancer, but to leave her kidney intact. Well, that's what she chose, and she comes to me about 3 times a year. I see her regularly. And 12 years later, cancer-free. She just had a new CAT scan. She just came in, normal exam, normal CAT scan. 12 years after radiosurgery for a proven kidney cancer in the kidney. She's cancer-free. Her kidneys are working fine. She has both of them, which is fantastic. I think it's what everyone wants. And by the way, we continue to follow our patients. We've been treating patients here in New York since 1987, so for many years, Dr. Gil Lederman is putting together data and actually has about 5 presentations at national and international meetings to present our data so that you and I and other doctors can be updated in the potential benefits of radiosurgery and our treatment. So, she's in our data. I know there's many of our former patients or earlier patients who listen. Yeah, come on in. Let's talk about your follow-up. Let's get you scanned if you haven't been scanned. If you're a new patient or never been a patient, you're welcome to come in. We're located at 1384 Broadway in the heart of New York City. It's easy to get to us. Sometimes it's even fun to get to us. We're close to Times Square and Herald Square and Macy's, and most of the trains, buses, subways come very close to us every day, minutes every day. We had a follow-up of a gentleman, a 50-year-old man. He's actually born in Iran, moved here about 30 years ago, has a head and neck cancer. It's past tense. Guess why it's past tense? Because he came to us for treatment. Yeah, he had a head and neck cancer. He came for treatment. We used focused beam radiation. He has done well. He's in remission. He actually runs and works in a pizza shop in Long Island. He's doing well, cancer-free, just came back, follow-up, physical exam, in remission, no pain, no suffering. We try to get him to stop smoking. He's still smoking. There's a couple risk factors for head and neck cancer. One is smoking. Actually, in men now, there's an epidemic in America of human papilloma virus-associated cancers. And you may remember Michael Douglas said that he thought he may have got his head and neck cancer from oral sex. Well, yeah, it is possible. In fact, there's studies that show that men with human papilloma virus are getting increased numbers of head and neck cancers. The cancers that are caused by human papilloma virus in men are actually more successfully treated than others. But if you have a lump or a pain in the mouth or the throat or the neck, yeah, you should come on in. There's a good chance, like this gentleman, treatment can be done without deformity. He chose not to have surgery. He chose to have our treatment, focused radiation, to hit the cancer and avoid harm to the healthy tissues. So he's an inspiration to us all. He's happy, his family's happy, and we are very happy for him. Speaking about saving lives or living longer, here's another story that's very interesting. Now, many people in America get colorectal cancers. And, of course, we know that colonoscopy should be done at the age of 50. It should be done on a regular basis. And it's probably most responsible for reducing the death rate and the incidence of colorectal cancer. But there's other ways of looking at the rectum and the proximal colon as well. And one is sigmoidoscopy, which is looking at the anus, the rectum, and the sigmoid, which is where most cancers in the colorectal area occur. This is a randomized study that was published in JAMA. JAMA is a journal of the American Medical Association, so a prominent journal. And this study was performed by Holm et al., looked at 100,000 people aged 50 to 64, and did screening over a couple years in these patients, 50 to 64, and looked at what happened to them. The results showed that there was a dramatic drop in incidence of cancer and mortality. So after a median of 10 years, the death rate fell. In the control group, there were 330 deaths. In the people screened, 71, meaning about a 75% reduction in death rate from colorectal cancer, just with flexible sigmoidoscopy. Easy test to do. It's effective, safe, should not be expensive, and can reduce the death rate of colorectal cancer by about 75%. So another helpful hint to live longer, to live better, to have a better quality of life, and to avoid the harm of this potentially terrible, even fatal cancer. And in the good news department, another patient just came a couple days ago and saw me. Each week, how do I make this radio program? Well, we get the news of the week, we get patients, we get stories that are true, we get facts that may help you, and then present it on a regular basis to you. Well, this woman had a lung cancer treated in 2002, so more than 12 years ago. She had 5 focus beam treatments. And by the way, why were we doing radiosurgery so long ago? We were doing radiosurgery a lot longer than that. We've been at this for decades. We were the first in America with radiosurgery for the body. We were the first in New York with brain radiosurgery. We treated about 20,000 patients over 2 decades. So lots of experience. We have a whole team that works together. And what are the possibilities? Well, I just told you a few minutes ago about the woman with kidney cancer, cancer-free more than a decade later. This is a woman with lung cancer, treated, cancer-free, years later, done well. She was treated actually for an ankle tumor in the year 2000. She was treated for a lung cancer in 2002 and remains cancer-free. So she came to me. She comes about once every 6 months. We check her out. She's doing great. She has new scans. Everything is A-OK. No side effects. The main effect is she is cancer-free more than a decade after treatment of lung cancer, which is a devastating disease for many people, just with non-invasive focused beam radiation. And another man who came this week, actually who came last week for the first time in terrible pain. He has what's called small cell cancer, an unusual cancer of the prostate. It's spread. He went to one of the very biggest cancer institutions, and he got a biopsy, he got staging, and then he had chemotherapy, 3 months of chemo for his small cell cancer. Didn't help. In fact, the cancer progressed. Then they gave him 3 more months, and the cancer got worse. In fact, a week and a half ago, on Tuesday when he saw me, he was scheduled for a colostomy. They were going to open up his belly, remove his intestines to the abdominal wall, and have him go to the bathroom through a plastic bag on his abdominal wall because the mass in his pelvis was so big. Well, that was at the big cancer center. He came to us in terrible pain. He couldn't. He was squatting and moving and twisting and turning. He was in terrible pain. So what did we do? Well, we talked to him about choices. That's why our phone number is 212-CHOICES. He wanted to come with us. We changed his pain medicines. He had been in terrible pain for months with us. We changed his pain medicines, treated him with radiosurgery to this huge mass in the pelvis. And somebody say, oh, it's too big, it's too small, it's too this, it's too that. No. Speak to the experts. That's why we're here, for a fresh second opinion. He came thinking he was going to have a colostomy last Wednesday. He came to us. We adjusted his medicines. We staged him up. We treated him. And by Thursday, almost all of his pain was gone. And he came back for the second treatment this week. I met with him. His bowels are going fine. He avoided that colostomy. Most of the pain is gone. He's having non-invasive treatment. We're planning to give 5 treatments to this big mass in the prostate. And most likely we'll be able to control this cancer. Obviously, we can't promise anyone anything. There's no always and never in medicine. But most likely, and we've treated thousands of patients, most likely we'll be able to control this cancer where we're treating it or shrink it. Sometimes even goes away completely, like the patient I told you about just a few minutes ago, the woman with lung cancer, the woman with kidney cancer. So we're hoping for good results, but so far we've been able to avoid that colostomy in him. He's been able to stop the chemo, which didn't help him, and he's on a regimen and a treatment that has stopped his pain and most likely is going to stop his cancer where we aim the treatment. My name, by the way, is Dr. Lederman at Radiosurgery New York. We have a caller, and we're going to take this call just for a moment. This is Dr. Lederman. You're on the radio.
Dr. Lederman?
Yes, sir.
Well, can I ask you a question?
Yes, ask the question.
Okay, here's the situation. I had